So anyway, I want to talk to blow my horns a little bit. I came to Canada when I was in high school, so you don't know my age, and attended university here. So basically, a naturopathic doctor must attend 4 years of regular university, but taking a medical course or pre-medical course, and then after this, you attend 4 years of naturopathic college. So this makes it 8, correct? And then you have to write a rigorous exam and pass the government exam, and that's me. And I attended the University of Toronto in 1975. In 1979, I joined the Naturopathic College, and I think I did well. And then in 1981, I joined the Chelation College in the United States, and basically I was teaching assisting in anatomy and physiology at the college, and in 1984 I opened the clinic I have right now, and it was unique of its kind. And the reason for that, if you go to any clinic that is supposed to be a large clinic, every individual, every doctor, every nurse, has his own file. So if you come to me to see me for a treatment, then I treat you, then I close my file and keep it in my drawer. You go to the other therapist has to treat you, and that therapist doesn't know what I'm doing, and I don't know what the other therapist is doing. Our clinic works on the basis of one file, goes out with everybody, and everybody works with one file. So everybody knows what I'm doing, so that they will not double prescribe for the patient, and they know what I'm treating that patient for, so there will not be a conflict during the treatment. So that's why that made us unique. Until today, we are the only clinic in North America who uses only one file for the entire office for the one patient. Basically, and from the mayor of Etobicoke came in that day and opened our clinic, marking that it is the largest clinic in North America. Today, I want you to go home with a box filled with information, as I started to tell you. I want you to know what toxicity. You know, over so many years, I learned from patients that everybody has wonderful excuse why they can toxify their body or underfeed themselves and still be okay with it. Also, people who do not eat well, they think they are trying to lose weight. They think they are trying to help their bodies, but unfortunately they are not. I want you to learn what food to eat so that you stay healthy, and also what food to eat to avoid sickness. The reason I use the word avoid, because I want you to know that this thing in our society, and it's going to invade everybody regardless of what you do, regardless of your status and who you are. These sicknesses come with the food we eat, our habits of drinking, our environment, and all these things, and our medication we use, and you will see this later on. So basically, the principles of alternative medicine is based on a German doctor, his name Dr. Hahnemann. Alternative medicine it's not new in Ontario or in Canada. It started back in Germany in 1880, and within 20 years it came to North America, to United States, and in approximately 1923 it was founded in Ontario, naturopathic medicine, and it was the main force of treatment for people. There was no such thing called medical doctor. This is new invention. We have medical doctors here? Anyway, so it was the medical doctor system is a new invention that branched off naturopathic medicine. And because of the speed of the system, of the medical system, antibiotics and cortisones and all these things start to recede for naturopathic medicine, and it was faded between 1930 and 1970. In 1970 it was revived, and now it's coming back because it's already legislated system. a naturopath, after studying for 8 years, you have the suffix after your name is ND, not an MD. And the basic thing in your teaching is don't cause any harm, treat the cause of the problem. Please realize that when you have a headache and you take an aspirin for it, you are not treating the cause of the headache. You are treating the location of the headache. A lot of time you will have a headache and your problem is because of your hypertension or because you have cervical pain. So we always focus on treating the cause, not the symptom. And then we treat the whole body. When a patient comes to me and says, well, I have a constipation, then I start examining the ears and the nose. And some people say, oh, my constipation is not in my ear. Do you know where my constipation is? Somebody asked me that question. And I said, well, could you tell me where? You said you only said constipation. I have to look for it. Where do you have it? So the person thought, but to treat the whole person, you examine everything else because there will be a problem elsewhere, even though you say only I have constipation, but you'll come up with so many things. So I take people, listen to people and follow until I find out yes, you have a constipation, but what caused it? Is it deficiency of enzymes? Is it improper digestive tracts? You don't have enough electrolytes in your body. So all these make a big difference in the treatment. And then your body is only unable to help itself when it's dead. As long as you are alive, no matter how sick you are, your body still has some abilities to revive itself. So part of the treatment is to make your body does part of the work. That's why I started my treatment unloading the patient with some remedies for a couple of weeks, and then after that the inner energy of the body start to work, and then I start to cut down as I go along. I found it to be working very well, and it is exceptionally easy for people later on. And also when people should be treated, they should be taking hypoallergenic remedies. I can't count for you the number of people who come to me holding very, very, very cheap products. If you're going to eat something, if you treat your neighbor, maybe you could do anything you want. But when you treat your own self, you go buy me a remedy, you go to health food store and you find 2 calcium bottles, one for $15 and one for $2, and you say, well, maybe I should save. And you buy the one for $2. I know in Toronto there are a couple of companies that clean sewer septic tanks, and they told me they found a lot of pills in the bottom of that sewer tank. And what happens is those pills did not break down. They are made so cheaply that you should always look for stuff that will dissolve in your body, rather go into the septic tank and dissolve there. The last thing is self-discipline. A patient, like I told about the person with alcohol.